Diane from Allied today talking about CHF, congestive heart failure. Your heart is failing and there's congestion. Okay? Remember, big words, big terms are just little ones stuck together. Pull them apart and look at them and they'll tell you everything. Okay, let's talk about this. So, congestive heart failure. Your heart is a pump, and it pumps that blood throughout your body. Okay? All right, so as it pumps the blood throughout your body, it pushes the blood through your kidneys to filter off the excess fluid so you can urinate it off, and the rest gets pumped on. Now, if your heart is not pumping effectively, if it's damaged, how does it get damaged? Oh, it can be damaged in several ways. One way it can get damaged is because of an MI, myocardial infarction. Myo means muscle, cardio, heart, cardiac, infarct. What's an infarct? An infarction is a block when things are occluded or backed up. Kellogg in Wichita gets infarcted frequently, doesn't it? If you've ever driven on our big main thoroughfare east-west to Wichita, it can get infarcted, yes. So myocardial infarction, heart muscle block. So how does a heart attack happen? If you have a blood clot or a piece of that fat or cholesterol coming through and it gets stuck, then that's a heart attack because the blood can't serve this area of your heart. Remember, your heart works hard. Your heart never gets a break, right? It has to pump all the blood for your whole body and doesn't even get a 10-minute break. You get a 10-minute. Your heart takes a 10-minute break and you're dead. So your heart has to constantly be on task, right? So to feed the muscle, the blood it pumps through it doesn't get to use. So your heart is fed by all these coronary arteries that wrap around the heart. These coronary arteries wrap around the heart and feed the heart. Now if you get a little blockage right here, you might just have a minor heart attack. But that part of the heart muscle will die. And that makes your heart muscle weaker. And a weaker heart muscle can't pump as well. That makes sense, doesn't it? Now if you get a block down here, wow, look how that would affect all of it. Things are probably not going to look very good. So, consider that. Now, let's say you had a little heart attack, a little myocardial infarction here. Your heart isn't pumping as well. There can be other reasons very much as well for your heart to fail. But let's just take this one to make an example. So, let's say your heart is damaged, so it's not pumping as well. It's not pumping as well and giving blood to all your cells. If your blood can't get to your cells, that means the oxygen can't get to your cells. And if oxygen can't get to your cells, you're weak. You're weak, you're tired, you're dizzy. That makes sense. Not only that, but it can't pump the blood through your kidneys well enough to filter everything out. It can't keep up with the demands of the body, of what the body needs. And so what happens? The fluid backs up. Congestion. You have congestive heart failure. Seen folks with the big puffy ankles, right? That's congestive heart failure. Now, so how do we help these folks? Few things you can do. This is right up your alley, folks. One is to understand that they're going to need rest balanced with activity. So it's going to take them time to walk down the hall to the dining room. They can't be rushed. If they're walking to the dining room, you may have to stop every 15, 20 feet and let them catch their breath. Because remember, their heart's damaged. It can't pump as well to give them everything they need. So they're going to need to stop and rest every once in a while. That's how that goes. You don't want to stop and give them the time to rest because you're too busy? Well, you're going to get more busy because pretty soon they won't be able to walk if you just, oh, it's okay, sit in the wheelchair, I'll take you. If you don't use it, you lose it. If they can do something for themselves, give them encouragement and praise, not in a demeaning way, but in a respectful way, so they can keep going with periods of rest, so they can keep as independent, keep as many skills, ADLs as possible. Okay? So, next thing, see how if they're sitting in a chair like this, like say this is a wheelchair, and they sit like this, where do you think that fluid goes? How does gravity work? Where do you think that extra, they're going to get like this, they're going to get big ankles, aren't they? Huge puffy ankles. So after they sit in the wheelchair for a while, make sure you prop their feet up. You can elevate the wheelchair pedals up, or you can put them in their easy chair. However, try not to elevate the ankles any higher than the heart. When the ankles go higher than the lungs or heart, then the fluid can back up into the lungs. We don't want that. That's not good. We don't want fluid in the lungs. Better to have the fluid in the ankles than the lungs. So what we want to do is prop the feet up, but not higher than the lungs. Okay? Next thing we can do, here's an example here. If you have someone who is in bed and they want to watch TV or something, you don't want this because the fluid can gather here. If you have to lay them flat to move them up in bed or something, do it quickly, have everything ready. Don't lay the bed flat and then be like, all right, let's see what comes first. You need to think it through, have everything ready, lay the bed flat, and then move them up like you're supposed to. And you know what that means? We bend their knees, put their arms in, hold on to that draw sheet, 1, 2, 3. Okay, so we don't cause shearing or friction and have more problems, wounds. Okay, so, and another thing we probably wouldn't want to do is this, because you know what happens there? They're going to slide down. And then what do? Pull them up, slide down, pull them up. And this is where we get the friction and shearing injuries. So just a little knee gauge, a pillow under the knees or something, and the head of bed not quite so up, just more on an angle like that. I'm not saying all night or all day, just this is a good position. Okay. All right, so that is congestive heart failure and some things we can do for our folks. Remember, give rest, position correctly, move in bed the right way.